Okay, we're gonna get started since we have a packed agenda today and just want to make sure we can get to questions at the end. So I am Tamri Hadani. I am the Associate Director of the Elder Abuse Prevention Program at the Institute on Aging. And I'm just gonna do the intro and then hand it over to Shauna Reeves. But some housekeeping and logistics. Just want to say that this is our first WeAdd event we've done virtually, and we forgot that webinars know no borders, but we are thrilled to have over 250 of you guys joining right now, but we had over 500 registers, so I'm hoping they'll just trickle in. But we have attendees from all over the country, all the way from California to New York, so that's really exciting. If this was in person, there would probably be only standing room. So this is exciting. The webinar is eligible for one continuing education unit. For those that submitted their license numbers and emails, you should be receiving a certificate in the next few weeks. In addition to our moderator and 3 panelists, we also have 2 American Sign Language interpreters joining us. So thank you, Ebony and Pilar. And the chat will be disabled during this webinar just to minimize any distractions. We'll be doing questions and answers at the end. So please submit your questions in the Q&A option below. It should be in your toolbar in your Zoom. And yeah, so we're going to get started. So every year, the Institute on Aging's Elder Abuse Prevention Program partners with the San Francisco Department of Disability and Aging Services to commemorate World Elder Abuse Awareness Day, which is also known as WeAdd. This year is the 15th anniversary for WeAdd, and it's a day for communities all around the world to promote a better understanding of abuse and neglect of older persons. Oftentimes, older adults and dependent adults get overlooked, especially when abused or neglected. So this year, we hosted a webinar series, and last week, the webinar we did focused specifically on COVID-19 related scams and local resources. We created a FAQ sheet in English, Spanish, Chinese, and Russian, and we're going to link those in the chat for you guys if you would like to access those. Thanks, Glenn, who's working behind the scenes. Today we are here to talk about the very important and pertinent issue of care and maltreatment in long-term care facilities in the era of COVID-19. We actually picked long-term care as a topic last fall, and with the high infection and mortality rates in facilities during this pandemic, we thought we definitely had to bring this topic to the forefront for our WeAdd event. So I wanted to thank the Department of Disability and Aging Services, San Francisco and Contra Costa Counties Ombudsman's Office, as well as the California Elder Justice Coalition for partnering with us for this webinar.
Thank you, Mike.
All right. As director, Shauna drives elder abuse prevention efforts in San Francisco, Santa Clara, and San Mateo counties. Shauna is part of a number of multidisciplinary teams that fight elder abuse through cross-agency collaboration, legislation, and prosecution. She is the tri-chair of the San Francisco Family Violence Council, a member of the California Elder Justice Council, which you will hear about a little bit more later, and most recently was appointed to the California Department of Insurance curriculum. Has spent close to or over 15 years working in the field of consumer justice and financial abuse prevention and other services, and often serves as a contributor to media. Shauna received her bachelor's degree in political science from Santa Clara University and her master's degree in social work with Smith College. And all of the success of our elder abuse prevention program is because of her compassion and passion, vast knowledge and expertise, and collaborative spirit. So thanks to her.
Thank you, Tammy. Thank you so much for that intro. Thank you, Glenn Fishman, for your behind the scenes work. Thank you to our panelists. Thank you to Pilar Marsh and Ebony Gaitan for providing ASL translation today. Very, very difficult to talk about abuse in long-term care in general, and right now during a pandemic even more so. Over 2,000 residents have died so far in long-term care facilities in California, and by long-term care facilities I mean skilled nursing facilities and assisted living facilities. Nationally, that number goes up to 43,000 people who have lost their lives in these facilities, both workers and residents. Preventing elder abuse, which is our mandate at the Institute on Aging's Elder Abuse Prevention Program, means addressing the systemic failures that allow elder abuse to occur and worsen. Low wage and limited or no sick time for long-term care workers, substandard working conditions, which includes lack of access to PPE, chronic understaffing, and poor oversight, all contribute to the pandemic hellscape the long-term care system finds itself in today. I also want to be mindful that the people who are most at risk of contracting and dying from COVID-19 outside of facilities, low-income communities, communities of color, especially Black communities and Latinx communities, are the same people who are dying inside the facilities, both as workers and as residents. Our speakers today will be addressing these and other issues and also suggesting things that you can do to help. As Tammy pointed out, at first the panelists will be answering my questions, and then we'll open it up to you all. We'll have about 8 minutes each. Before we get started, I wanted to ask a question of the audience to see if you could guess the answer. Glenn, if we could kick that poll. According to a recent GAO report, that's the Government Accountability Office, what percentage of skilled nursing facilities in the US that were surveyed from 2013 to 2017 were cited for infection prevention and control deficiencies? 15%, 34%, or 82%?
Hello. Hi, Tammy. Listen, I got it together. I had to go into my audio settings and redo it. And I was way behind because I didn't dial in at 10 to 10 or 9:50. So.
Okay, the results are in, and you're right. 82% of long-term care facilities were cited for infection control deficiencies, and over half of those had this happen more than once. So we're going to get started with our first panelist, attorney Mike Dark of California Advocates for Nursing Home Reform. Mike joined Cantor in 2019, and prior to that, he spent over 20 years in private practice litigating complex civil class action suits on behalf of consumers and investors. Mike's main focus at Cantor is representing long-term care residents in eviction defense and neglect and abuse matters, as well as doing health policy work. When I was discussing with my coworkers who would be introducing the panelists today, I said I wanted to do it because I know all three of them. And then I realized I've actually never met Mike. I just feel like I know Mike because every article I read about the pandemic and long-term care, or every video I see, has a great, amazing quote from Mike, sometimes several. When Mike's interviewed, he often will give a quote that makes you almost forget everything else that was said in the article or video prior or after, because they're so poignant. So I want to bring up one of your quotes, Mike, from an interview you gave to CBS News. You said that while there's no question that this virus is an act of God, the crisis in California's nursing homes is an act of man. So if you could explain what you meant by that for us.
Thanks for that kind introduction, Shauna, and thanks so much to all of you and my fellow panelists for participating in this really timely topic that we have today. What I was driving at in the quote is that this pandemic and its consequences, especially for our elder and disabled community, is a very difficult thing to talk about because people feel like if you describe just how bad it is, you're vilifying or you're finger pointing, when really what we're trying to do is use this moment we have in time, this window, to understand what is going wrong now and how we can do things differently to save people future. And this topic of abuse in the context of COVID is so critical because while the virus is new, the conditions that have promoted its spread inside nursing homes, not just in the United States, but in places like Spain and China and Italy, are the results of long-standing problems. And the thing that made COVID so terrible, even as far back as February, we knew it was going to have terrible consequences, has to do not only with its target demographic, which is older people, people with serious underlying medical conditions, which is almost by definition the people who live in skilled nursing facilities and long-term care. But it's also the fact that there's really no treatment for it. And so the only thing we can really do with this virus is prevent it. And in the context of long-term care, especially skilled nursing facilities, prevention revolved around two key things: infection control, which you just spoke to a little bit about, and good staffing. And the problem is that long before this virus hit, those were two crucial areas where nursing homes had disastrous problems that long predated the virus. And they kind of go hand in hand because staffing is the #1 expense item on most nursing homes' balance sheet. These are principally almost always for-profit entities, skilled nursing facilities at least. And to save money, what a lot of operators do is cut staff to the point that many facilities become less like places for care and more like sort of warehouses for human beings. And care that's being delivered by a CNA, these are disproportionately women of color who are making $10 an hour and are having to see 10, 12, maybe 15 residents an hour. If you do that math, that's about 4 minutes to bathe and give medication and hydrate and feed these residents, and now also wash hands before and after. It's easy to see how the conditions were ripe. They were ready for a virus like COVID to spread like wildfire, and unfortunately, that's what it's done.
And I'm glad you spoke to staffing. I was struck by something Dr. Charlene Harrington from UCSF said on a UCSF COVID-19 grand rounds 2 weeks ago. She said that only 35% of the money in nursing homes goes towards patient care. Where's the rest of the money going? And how can we get it into patient care?
Well, I think it's a canard that people can't make money on nursing homes. There's lots of nursing home operator and owners who are millionaires or even close to billionaires. There's lots of different ways that they can extract money from cash flow, even while an individual operation looks like it's just breaking even. So most of the money, most of the excess money, if you want to call that, is not going into increasing salaries, for example, for caregivers, but into the hands of owners and operators. But it's really important to understand the link between working conditions, especially wages, and infection control. This isn't just a sort of a fair labor issue. The problem is that if you're making $10 an hour, and especially if you have no sick leave, if you're working at a facility where the virus is spreading, you may not have a choice to stay home if you're starting to feel sick yourself, if you don't have leave, and your family, multiple generations of your family are depending on you to bring home that paycheck. But also, crucially, you may not be able to work at only one facility. You may have to work at 2 or 3 at a time in order to make ends meet. And this, we know, was the kind of springboard that the virus used to spread from one facility to another throughout the country.
Right. And I see Nicole shaking her head because California Elder Justice Coalition had worked on a policy proposal trying to figure out a way so that workers in these facilities could stay to one facility. I know that in, it was in Ontario, I believe, Canada, one part of Canada, where they said, because the nursing homes are more centralized there, they said, okay, people working in nursing homes can only work at one facility. And with that came increased pay and some other great things that made it feasible for them to just stick to one facility. But here it seems like we don't have a system in place right now so that workers don't have to move between facilities. So I'm really glad that you brought up all of this. Because I do want to give the people on the Zoom a little bit of hope. Mike, are there things that people can get involved in right now, initiatives, either with Canner or with other groups? Are there ways that people can get involved to make sure that these residents are protected or get more protection, since this pandemic obviously isn't going away? We're kind of in the early days of it, actually.
Well, it's such a great point. This is like, some people say it's a second inning of, a 9-inning game. It's not even 9 innings. This is probably more or less what life will be looking like rolling forward for years in nursing homes for lots of reasons. So it's not about outlasting the virus. It's about changing our expectations for nursing facilities and what kind of protections we want to ensure that residents get here on out in order to keep them safe. The biggest problem I think that residents have in nursing facilities is all of their safety nets have just fallen away over the course of the last 3 months. The first and maybe most crucial was visitors. This wasn't just like people going in to hold their grandma's hand because it makes her feel better, although emotional support is so crucial. This was family going in to feed people, to make sure that they were hydrated, to make sure that they didn't have a bed sore that went down to the bone. And those were problems that existed principally because of the staffing and infection control problems that predated the COVID. And it was really the eyes and the ears of families and friends who are coming in, seeing their loved ones live, seeing what condition they were in, advocating for them inside the facilities and outside, that helped keep them safe.
Right.
Effort to stem the flow of the virus into skilled nursing facilities, we stripped away maybe the most important level of oversight and protection that visitors had. Now that we know the virus is in most facilities, probably a majority, maybe 2/3 in California, it's essential to start rethinking the calculus on this, because if we can get at least one family member with PPE, trained in what the right social distance is, to go back in to provide that kind of support, we will be saving lives. And that is a critical pressure point that anybody who has loved ones in nursing homes or cares about their welfare needs to bring up with Department of Public Health, with DSS, with the governor's office, because we've got to see that change.
Great. And if they go on the Canner website, you have that section of your website that's just dedicated to COVID-19 issues. I think that's a good place for people to start. Thank you so much, Mike. And I'm glad that you ended by talking about people lacking support in facilities. I think people think of visitors as purely emotional support, but what you're pointing out is that often it's hands-on care that was being provided by these loved ones, and that's been cut off as well. I'm going to turn it over to, thank you again. I'm going to turn it over to Benson because he is the person in San Francisco responsible for investigating abuse allegations in San Francisco in long-term care facilities. He is San Francisco's long-term care ombudsman. He's held that position since 1987. Prior to that, he was coordinator of another program in Mendocino and Lake counties. He's worked on regulations, sponsored 3 legislative bills, and testified at the Little Hoover Commission on long-term improvement for long-term care facilities. Benson also has excellent taste in music. I'll let you guys all know that. I want to start off by having Benson tell us a little bit more about the Ombudsman program and how your and your staff's jobs have changed during the pandemic.
Yeah, we've had to work offline with developing some systems that would allow us to use FaceTime and Zoom with actual residents. We've also been working with families and attempting to get a list of all the family members as contact lists from the different nursing homes, but they're kind of reluctant to share with the program the contact lists. We can get the name of a contact list if we are actually working on an abuse case, but just to get a general list of family members to actually organize a family council remotely is kind of challenging. We have at the end of this particular month using Zoom, and I hope the technology works adequately to have a family council meeting with Cantonese-speaking family members at one of the skilled nursing facilities in San Francisco.
We have a frozen Benson. Okay, he's back.
Skilled nursing facilities. Some want to deliver food because one of the main sources of neglect is many family members, particularly in the Chinese community, sit by their relative and slow down the time it takes to feed somebody. And we're getting anecdotes indirectly of weight loss, some failure of thrive issues. And it gets really frustrating because ombudsmen themselves cannot actually go in and visit. And when we do call different staff in the nursing home, sometimes with Zoom, we don't know if they're telling us a straight answer or whether they're giving us a massaged answer. So we have handled some abuse reports by actually doing Zoom interviews with residents. And the unfortunate thing is, with one resident at Laguna Honda, a social worker had to hold the iPad, and he started interpolating what the answers to my questions were, and I had to tell the social worker to not filter the message, and I asked more questions. And let me give you a rundown of how many abuse reports we're getting. We're probably having a drop of 35, 40%. We used to get 60 to normal times. We've had a significant drop. What we had to do was to be able to review our abuse reports using a box system. So it's PHI, and we can access the box and review the SOC 341s. We actually had some money to hire an abuse investigator, and in the absence of him actually visiting facilities, he is trafficking all the SOCs to the regular assigned ombudsman. And we're doing interviews with the most serious abuse cases, which mostly involved a resident being abused by a caregiver and sometimes neglect. If I were to give a snapshot of the types of abuse that we're focusing on during the pandemic, we're focusing on neglect, we're focusing on poor discharge planning, which comes along with the facility. In fact, they're kind of linked together, the two notices that get sent to the Ombudsman office, the abuse reports, and also the transfer discharge notices. They are linked together because sometimes discharge planning is neglectful and people are being sent back into the community without full due process, and also with a bad discharge plan that requires cross-talking with the APS assigned worker. So that, neglect is one of the focuses. The other is nothing that ever gets reported, and that's what's called psychological mental abuse, and that includes things like suffering because of isolation, suffering because there's no adequate psychosocial supports anyway in the nursing home. Mm-hmm. Do clinical support who have psychosocial needs, and that's been exacerbated by the isolation and agitation and the uncertainty that individuals feel watching all the TV news about the pandemic and about Black Lives Matter, and there's no one to kind of balance all that news in terms of processing the information. And for the individuals who have dementia or cognitive deficits, either in assisted living or in skilled nursing, they can't process the instructions to be safe. They need extra care, and they're not getting it from the staffing that's been really cut even more drastically than before the pandemic. So the Ombudsman is really frustrated by not knowing what's going on inside the minds and hearts of the residents. So with mental and psychosocial abuse that never gets reported except by family members. And so that is a real crucial focus during the pandemic for the Ombudsman program. The Ombudsman program has also had numerous Zoom meetings in terms of care. We've had a few evictions from skilled nursing. And as everyone knows who's an advocate, that evictions require a fair hearing through the Fair Hearing Office in Sacramento. And we've had 2 of those during the pandemic where everyone dials in. And we had 1 win case and we had 1 uncertain case at another skilled nursing facility. The facility that sends us the most abuse reports is Laguna Honda.
Okay.
There are at least 6 skilled nursing facilities who are not sending us any abuse. Of handling, no psychological abuse, no neglect. I just think that they're busy managing the COVID pandemic and managing staffing, and they're pretty preoccupied. So what we've done at the very beginning, we've actually checked in with the local health department to see how the residential care homes are doing, how the skilled nursing facilities are doing, even though we may not get a straight answer. We've asked questions at the guidance of the Department of Public Health. Do they need face masks, PPE? And we've also been communicating with the testing people who've been going into skilled nursing facilities. We've focused on certain ones that are outbreak facilities that we find out about in the newspapers before anyone tells us. And we've been dialing constantly. And also with some of the identified skilled nursing facilities. And so we're doing the COVID monitoring as well as handling abuse reports. So it's been pretty busy. We have an abuse investigator with APS when we come out of this blanket and no contact. And we're trying to set up resources for some kind of indefinite future when we can go back to some kind of normalcy. But that future is going to be different.
Yeah. Thank you.
Now,
Benson, we
need a question, Shauna.
Oh yeah, we need to move on to Nicole, who's also an ombudsman. So I think you guys are going to be touching upon a lot of things. Benson, someone on the Zoom had asked if we had handouts. I was wondering if that great crib sheet, as you call it, that you put together, could be something that we could give to participants after this call.
Well, I have a handout PowerPoint that I developed, and I can send that to whoever wishes it.
Okay.
It was developed specifically for this period of time.
Great.
Kind of
We just didn't want to do it without your permission, but I think that'd be a great resource.
Distributed as a handout specific to COVID-19.
Right, great, because we know you have a lot more that could be very useful to people. So thank you so much.
Okay, you're welcome.
Yeah. So next we have Nicole House. Nicole is Director of Ombudsman Services of Contra Costa, Solano, and Alameda counties, because one county is not enough, where she's responsible for ensuring that 29,000 long-term care residents in her community get high-quality care, respect, and are able to live lives free of abuse and neglect. She's also on the steering committee of the California Elder Justice Coalition, where I can attest that she lends her considerable energy, smarts, and policy prowess to making elder justice a reality. Nicole is also a giant A's fan, so I apologize that there won't be any games for a while, but just want to put that out there that you're a giant A's fan. Benson just spoke about the San Francisco Long-Term Care Ombudsman Program, what's going on the ground, his frustrations, kind of where maybe things should be going. Is there anything you'd like to add about the power and the role of the long-term care ombudsman, especially during the COVID-19 crisis?
Yeah, I think as long-term care ombudsman, we sort of fix some concrete issues where we're actually having a care conference or there's licensing involved and there's a really clear outcome. But then the role of the ombudsman is felt well beyond that because we make unannounced visits and we make them frequently on a daily and weekly basis. There is a way in which our influence is felt beyond just a conflict or a complaint investigation. And I think when ombudsmen are not in the building, we're really seeing that without us, that care really does change. It doesn't mean that all facilities are doing it badly, but it does mean that the long-term care ombudsmen are a critical part of the supports for residents. And that there is time as we start to think about how sort of visitors can return, we also need to think about how ombudsmen can be returning as well. It's very important that we start to sort of, as Mike says, sort of navigate the new normal and find ways for ombudsmen to be able to be there to represent residents' rights. We are finding that residents they call us and they're expressing concerns and we're doing care conferences and complaint investigation as best as we can, but many don't want to say that it's them. And the beauty of long-term care ombudsman is because we're in facilities and we become like wallpaper, that we're able to sort of bring up issues to facility staff. So residents don't have to be the complaining party. And so I think that without ombudsman there, it's deeply concerning to me about what is happening, because now that we have gone, more than 90 days, I think we need to be aware of what the real change in culture of care is.
Right. Thank you. So you're talking about being proactive versus reactive, especially important during a pandemic. So Massachusetts recently issued guidelines where people can now have visitors as long as the visits happen outside. From what I can tell, it's not mandated, but it's an option. Is anything happening like that for California, or are we waiting for new CMS guidelines to come out? What have you heard about this?
I think it's both and. Benson and I participate in weekly calls with our state ombudsman and hear what's going on with our colleagues around the state. And we are starting to hear about some counties, their public health officer, issuing new guidelines as it relates to long-term care. And as a state, and as we are certified through our Office of the State Long-Term Care Ombudsman, we're also waiting for guidance through CMS and California Department of Social Services to see how we'll proceed. So I think it's like so many things we're seeing across the state and country, which is that some things open up at different times, which we might see some counties begin to open up while others, it might take more time. And I think we need to look about that as an equity issue of making sure that all residents have access to advocates, not just some residents. And I think that there's ways to do that safely.
Great, cool. One of the things that brought me so much joy was seeing how you just got out there right away and you both were thinking with a policy hat, but also thinking about what people's concrete needs were. And your office was out there doing PPE drives and delivering this to RCFE staff. Can you tell us a little bit more about that? How that came about? Are you doing more of them?
Yeah, in Contra Costa, thanks to a partnership with our county public health and their Office of Emergency Services, as well as Choice in Aging, another nonprofit senior service provider in our area, we were able to do 2 PPE drives serving more than 300 facilities and 3,000 residents. And what we need to remember is that while many facilities were part of a supply chain, many were not. And while I wish they would have procured it for themselves, I'm not willing to risk residents' lives to do that.
Right.
And so we were able to do this PPE distribution of masks, gloves, sanitizer, and partner with public health to get information about what the facilities are needing. We're able to sort of help them and get them the resources. So now they're having visits from public health nurses. They're being given a binder of resources and information that's been tailored to them. And I think what's important to know is that, as we were starting to hear the stories in January and February, and we began to hear about the center in Kirkland, Washington, ombudsmen across the country were screaming. I mean, I'm not sure if you could hear our cries of talking about what Mike is saying, which is the staff working at multiple facilities, worrying about how that's going to carry the virus. We were trying to think of ways to be inventive. And as Benson says, facilities have to report to us, but sometimes the way that you build a relationship is by, giving a little to get a little. And we found that those facilities that participate in the drive were telling us their real struggles and challenges, and we were able to help them and their residents. And so that was really a great way that we felt like we were finding a deeper connection. If we can't be in facilities, we can at least be supporting residents.
Right. Love it. Thank you. So we went from the concrete, and now I'm going to go back to the policy. So you're a big believer in the power of older adults to affect change through policy efforts. Can you give us some examples of that? And also, are there places where people on the Zoom call can go to find out more about ways that they can help get involved in policy efforts as well?
Yeah, so I think that that's what we've seen with the Older Americans Act and the Older Californians Act, right? Those were folks who were older adults and their families saying, we need particular protections for as we age. At my organization, we think aging is like a really distinct stage of life that has its own exciting things and hardships, just like it was for me to be 0 to 18, right? There were some really fun things about being a kid, some really hard things too. And so I think that's sort of what we see as a demonstration of efforts really sort of individuals advocating for themselves. I think a couple ways to be involved. First of all is look out for what Justice and Aging is sending out. They're sending out some great alerts about how you can connect with your legislatures. I also think that two other things that come to mind in California, which is California Commission on Aging and California Senior Legislature. These are seniors who represent their district, if you will, and advance policy to advocate and to improve the lives of seniors. I also just think if you'll start listening to your local city council meetings, and right now is a great time because as cities are talking about what services they're going to have to cut or how they're going to retool budgets, when you start hearing about cuts to senior services like meal delivery, like senior centers, that is the first chance to get involved. And so I think it's always good to start where you live. Understand what kind of senior services are out there and understand how you can get involved with also your local advisory council on aging. And I would always say the California Elder Justice Coalition is, we value the contributions of everyone and want to hear from you.
Right. Wow. Thank you so much. So we talked about specific policy issues, and I know prior to this webcast, we talked about other things you want to touch on. And one of the things you wanted to discuss was the elder justice framework in California and across the country. So could you tell us a little bit more about that too?
Yeah, so I think what we see when we see advocates on the ground like Benson and my long-term care ombudsman colleagues is we're doing the work on a daily basis of advocating and improving the quality of life for seniors. And I think we need those hands-on advocates. And then we also need a framework of folks who are advocating to advance policy and corrective action to build the future. And so the California Elder Justice Coalition, which you and I are honored to serve on the steering committee with others, we are always looking out for policies nationally and locally that can help us impact seniors' lives. And so I think it's important to note that the elder justice principles, while they also include good care, access to food, there are also bigger issues like transportation, voting rights, housing policy, wraparound support services. And these are the same principles that we also see in other movements like women's and LGBTQ. And what is particularly salient right now is the rights for people of color. And so we draw from those movements and we take those underpinnings and we stand with them and we seek to include older adults in those policies. So I think the framework is like the sort of a local elder justice coalitions that are popping up across the country that are coming together to see how some areas are doing things really well and some areas we can improve on and that we can share through that network. So I really like the term when we talk about elder abuse. I like the bigger framing of elder justice because I think that elder justice is sort of at the place of sort of like justice for children was at in the 1980s and 90s, where we're talking about it differently and we're realizing the rights of individuals regardless of their ability, if they experience dementia or otherwise. And so I think when we talk about elder justice, folks aren't saying, oh, well, I'm not being abused, that doesn't apply to me. But if we talk about elder justice, what that means is like we all need transportation, we all need food, we all need supports. And I think it broadens the conversation to sort of a bigger table for us all to sit at.
Right. For more people to get involved. Thank you. So I can tell that, not to brag, but I think that we picked the right panelists for this webinar. And the idea that it wouldn't just be talking about the devastation in nursing homes and assisted living facilities right now, well, definitely that is the focus. We also wanted to give people a little bit of hope and a chance to get involved themselves. And I think that the three of you have really helped with both of those things. So we are now going to open it up to the people on the call.
Yeah.
This is not my forte, so Tamari's going to do it.
If anyone has questions, please submit them in the question and answer box that is on the bottom of your Zoom panel. But I do have a few questions already coming in. So people are very surprised that the Ombudsman staff are not allowed to go in the facilities. They asked, how did you guys feel about that and how you're fighting that? And then I know you kind of touched upon this, Benson, but if you want to go in a little bit longer or a little bit deeper into this, what are you guys doing moving forward, again, to check in with them, with residents?
That was a question to me, Tamara, because the screen is freezing, so I missed some of the
oh, yes,
words.
to you and Nicole, I think.
Okay,
so how are you and your staff and volunteers moving forward, trying to push oversight and checking in with the residents?
And indirectly, CMS is. We've already ordered PPE from the state emergencies. We're going to start visiting RCFEs first because of the CMS restrictions on skilled nursing. But we're not going to have any volunteers over 65 visit. And for any of the staff who have vulnerabilities, we may not be visiting either. So it's going to be a hybrid model to deliver Ombudsman services. We're still going to do a lot more remote contacting, and we're going to actually do some visiting. And we haven't really figured out the prioritization for what gets visited or not. If it's real urgent, we might have face shields and gowns to go in. We're going to have to rent a room somewhere so that I don't bring anything inadvertently back to people I live with or I come in contact with. So that's another consideration. Now, that's what they're doing with staff at Laguna Honda. They're putting them up in hotels. They have the budget. We do not have the budget, that kind of special room. So, and there's still debate as to whether or not Ombudsmen are going to be tested every 2 weeks. The testing issue has become much more problematic for even residents throughout the United States and within San Francisco. And I refer to the KQED news article, which quotes Mike about the inconsistencies in testing, not only once, but twice, retesting and the whole thing. So if Ombudsmen get tested, it's going to have to be a series of tests. So we are going to proceed with extreme caution. We're not going to just with the green light jump in and start visiting it again. It's going to be a phase-in process. That's what I see as the future for Ombudsman services within San Francisco. But we will follow the lead of the state Ombudsman.
Okay, I'm going to move on. So there's a lot of concern about family members being able to visit. And so this was specifically to Mike, but I don't know, anybody can answer, but is there anything written, have you written anything about the importance of family members, but also related, that we had multiple questions about this. What can family do to advocate for their loved ones that are in facilities? And then is there an ETA of maybe when they might be able to visit?
Sure. What a great question. One of the terribly frustrating things about the pandemic has been the suspension of all the rules and the legal structures as we knew as they existed 6 months ago. So if someone asked me 6 months ago, what's the federal patient bill of rights view on visitation? What does the state think? What does the Department of Social Services think? I could tell you with some confidence, and that's important because that consistency is what allows families all over the state and in fact all over the country to know when a facility is maybe going too far in restricting visits. And just as important context, even before the virus hit, facilities didn't actually like visitors all that much. They often caused trouble from the perspective of owners who didn't want to provide more staff, address problems, pick up messes and deal with infections that visitors were seeing. So it's not that, facilities liked having visitors in the first place. And then with the pandemic, what happened is you have county mandates, you have state mandates, and you have CMS mandates, and they're all written in a kind of bizarre, non-mandatory language where they say, we recommend, and facilities should, and especially when you look at the exceptions that exist under these different rules or guidelines for visitors, under the CMS guidelines, for example, there's a recommendation that in end-of-life scenarios, so-called compassionate care scenarios, that facilities permit some kinds of limited visitation. The state Department of Public Health has said if a resident is cognitively impaired, for example, and needs essential visits from a family member, that should be permitted. But none of these rules are written in mandatory language. And so basically no facility is permitting visitors, even when there are exceptions that have been written into some of these rules that could let them do it if they really wanted to. So what we really need is clearer, stronger guidance from authorities, not just the CMS, also California Department of Health, making it crystal clear when visitors can go in, the circumstances if someone has the right PPE. But barring that, until that happens, and I pray it happens soon, phone calls, Skype, FaceTime, but not turning your back on loved ones, not giving up on trying to communicate, because any information that you get or that you can even share with other families, with residents in the same facility, you can support one another with that kind of information sharing. That's what we're all going to be having to do together until the rules.
Can I add something to that, Shauna?
Yes, please.
In addition to sort of getting clarity that there needs to be a more interconnection between California Department of Public Health, community care licensing, and local public health. I think that is part of the problem that leads to sort of ombudsman being prevented from entering buildings. Is I heard from a public health official, well, we didn't mean you guys. And so I think that's the problem, is because sometimes long-term care is deeply misunderstood, and there was a rapid reduction in regulation just flying out the door on just an hourly basis for a few weeks. That once there is an infection, sort of the licensing entity steps back more and public health steps in, that there is a lack of clarity of who is addressing issues related to quality of life and quality of care. And so I think that what we have learned is, while we may have all had robust emergency preparedness strategies, that this wasn't expected. And so we need, after this, we need more MOUs, we need more ongoing collaboration, and really helping people to understand the long-term care landscape.
Great, thank you. I'm going to do something really unusual here and say we've had an incredible number of questions and very important questions submitted, and we're not going to get to the vast majority of them. If you've submitted a question in the chat box and you want to talk to one of us afterwards, sorry, I'm volunteering the panelists. I will be the person responsible for
Why don't they email EAP's email?
Please email EAP's email. Tammy, can you tell them the general EAP email?
I think so. I think it's just eap@ioaging.org, and
right. And
Glenn will put that in the chat.
If that bounces back, SREEVES@ioaging.org. A lot of the questions people are asking have answers, so I just want to make sure that we get you the information that you need. And a lot of the questions are also about whether there will be handouts. So we will collect those as well. Canner's website is, you could check it out for days,
cool.
And you could learn so much. That's like the website that everyone tells me they like the most. And there's also great information on the CAJC website. I just want to make sure that people get their questions answered if we're not able to do that on the webinar.
Great. One question I thought that was really interesting was in the beginning, Mike, and I think all of you guys have touched upon this, how can we support these facilities to hire the right staff and retain the staff. And so one person asked, is there any focus on increasing the reimbursement rates from Medicare or Medi-Cal so that facilities can actually have the revenue stream to hire better CNAs and pay them a good salary?
Mm-hmm.
So I'll take a quick stab at that. One very thorny issue with approaches like that is that when there have historically been efforts to push money into the nursing home industry to improve things like staffing, and there was a specific proposal relating to staffing about 15 or 17 years ago, the money simply doesn't make its way into the hands of the staff. And so if money is allocated, there has to be careful accountability and strings attached to ensure that facilities are actually spending it on the caregivers who not only deserve it, but need it now as an infection control measure to keep the virus from spreading.
Great. Is there anything else you guys have to add to that?
I would say there's a couple things. So there's also how we're training CNAs. And that is the current system that sort of prescribes their curriculum is rigid at best, and it doesn't prize innovation, and it doesn't sort of prioritize the skills that they need to be successful, which, you know, it's not your skilled nursing of your mother grandma's day 30 years ago. Like, they're real people with current problems and challenges. And so I think we need to look at what we're requiring for CNA students and also make it much more holistic in nature. And again, I'm always on Mike's train of they should be paid a living wage. They are, and I say to all of us who are elder justice professionals is CNAs and direct care workers are part of our team. And I want us to have a wider tent that includes them. We cannot care for the folks that we need to if they do not have, if they're not really well cared for, and if we're not raising them up.
Thank you. So there were a lot of questions about cases being brought forward. I don't know if we've had enough time go by, but someone asked, are you seeing an uptick in elder abuse lawsuits against skilled nursing facilities as well as residential care facilities?
So I would say there certainly has not been a huge wave of cases relating to COVID. I think there are, if anything, fewer than normal cases relating to abuse taking place in facilities because there is so little access to residents right now. Often it's family and visitors who are the first to spot the kinds of very serious forms of neglect and abuse that give rise to cases. But crucially, there's also been an effort by the healthcare lobby industry in California to push for immunity, criminal immunity, administrative immunity, civil immunity, very broad immunity to any kind of lawsuit relating to care that's during the pandemic. Now, Newsom has not yet signed off on that. He has had some very strong pressure from the lobby groups to do that. But if he were to do that, you know, we've been talking about safety nets. That really is the last thin protection that many residents have. The prospect that if they're killed or if they're seriously harmed, at least a suit could be brought against a reckless facility. And that would not happen if this immunity goes through.
Thank you. And has the Ombudsman had seen an uptick in complaints of neglect or maltreatment at all?
Tammy, this is Benson.
Yes.
San Francisco. We've had an uptick in regular neglect cases. And let me tell you who the mandated reporters tend to be. They tend to be acute care settings, emergency rooms, and sometimes so.
Tamari, can I just add that we heard from our state ombudsman recently that between February and April, there's been a 40% reduction of elder abuse complaints.
Increase in neglect coming in from these mandated reporters who are outside of the skilled nursing facilities. And that's been one of the main focus in terms of
trying to remedy the neglect remotely. We've had trained ombudsmen to ask certain questions about MDS and some of the documentation required for nursing homes. And we've attended care meetings remotely when a neglect complaint or abuse report comes in. But we still feel there's more neglect going on.
Nicole, did you have anything? Sorry.
Remaining
Thanks,
employees.
Oh.
No, I was just adding that across the state, we're seeing a reduction in abuse complaints. And it's what you're hearing. You're hearing a lot about sort of children being out of school and there being a reduction in CPS reports, that when there's fewer eyes on residents, that those reports are going to go down. And I think also when there was sort of a rapid change in regulation, folks were like, gosh, do I still report? And I think that that's an area where we need to come out sooner and much stronger on the continued need for protections for residents.
Thank you. Due to time, I think we're going to hold off on the questions, but as Shauna said, please email us at eap@ioaging.org, and we will try to answer those questions, and we will also be following up with some links and handouts as well, and if the recording worked, we'll send that out. Shauna, did you have any closing?
Mari, I'd also encourage people with questions for Canada to just reach out straight.
I might route some to you, Mike. Thank you. And thank you to everyone on this. I feel like we covered an awful lot in an hour, but of course you can't cover it all. So again, email us with those questions. But really, I just wanted to thank you, the three of you, for being so knowledgeable and so caring and giving everyone so much great information. And thanks for being on the call, everyone. All 250 to 500 of you.
Thank you.
Thank you.
Bye.
Bye.